Welcome! Being an adult can be difficult. When you're an adult living with ADHD, daily life can be extra challenging. As ADHD begins in childhood, some people might commonly associate this diagnosis as being prevalent only in children. However, it is indeed something that persists into adulthood as well. Approximately 5% of children and almost 3% of all adults meet the criteria for a diagnosis of ADHD. Some individuals might have more difficulties with inattention, where they experience challenges with staying on task, sustaining focus, and staying organized, while others have more difficulties with hyperactivity or impulsivity, where they feel restless, talk excessively, or fidget. Others may notice they have struggles in both of these areas. A little later on in this video, we'll actually discuss the potential benefits of having ADHD, as well as what can be done to manage it if it's causing life to be difficult for you. But if some of the symptoms discussed in this video sound relatable, then please consult with a mental health professional to clarify any potential diagnoses. ADHD, or Attention Deficit Hyperactivity Disorder, is characterized by a pattern of inattention, hyperactivity, or impulsivity across multiple settings. So just because someone is bored at their job, feels restless sitting in a classroom, or gets easily distracted during a conversation with someone, it doesn't necessarily mean they have ADHD. Rather, it may be due more to that specific situation or activity that's causing them to respond that way. But if these individuals notice these issues across multiple settings or situations, then ADHD might be more likely. When adults experience ADHD that is predominantly inattentive, they might notice that it's more difficult to give close attention to details, or they make careless mistakes in their schoolwork, at their job, or with other activities. They can have trouble holding attention on tasks or during leisure activities. When interacting with others, it may seem like they're not listening when spoken to directly, or that they're often distracted. It can be a bit more difficult for those with ADHD to follow through on instructions and finish schoolwork, chores, or duties in the workplace, leading them to getting sidetracked or losing focus. Organizing tasks and activities can also be a challenge. Tasks that require mental effort over a long period of time are often avoided, disliked, or lead to a reluctance to do so. When they're at work, for example, they might be more likely to be perceived as lazy or irresponsible. Individuals with ADHD might often lose things necessary for tasks and activities, such as their phone, glasses, keys, or other items. Forgetfulness in daily activities can also be common. For those adults who struggle with hyperactivity or impulsivity, they may be more likely to fidget, feel restless, or struggle to sit still. When they're involved in leisure activities, they may not be able to engage in them quietly. They can also feel as if they're frequently on the go or driven by a motor. In social interactions, adults with ADHD are more likely to talk excessively, interrupt others, or intrude on conversations they weren't initially involved with, even without intending to be intrusive. They might see more conflict with family members or experience rejection or teasing from peers. In addition, they might also blurt out an answer before a question has been completed. Having to wait their turn can also be difficult, given their tendency to act more impulsively. When people are impulsive, it's difficult to delay gratification. Rather, they may act hastily without any forethought, striving for immediate rewards or pleasure instead. These symptoms can cause a variety of difficulties for adults. Adults with ADHD are actually more likely to be at risk to develop problems with substance abuse or obesity, sustain injuries, be in car accidents, and even attempt suicide. Before we move on to discuss ways to better manage ADHD, we cannot ignore how some of these symptoms can actually be used as strengths. For instance, individuals with ADHD can actually be rather hyper-focused on tasks they're really interested in, allowing them to be quite productive. They can also be very creative and think outside the box. If they experience daily challenges because of their ADHD, but are able to persevere and overcome them, it shows they have resilience. Their propensity to be talkative means they're socially engaging and can easily strike up a conversation with someone. Their hyperactivity or high energy can have an overall positive impression on their workplace, allowing them to have more social interactions with their coworkers, being more humorous, getting promoted faster, and generally perform well at work. Their elevated energy levels may have benefits in other settings too. But when ADHD is interfering with their daily lives, one safe and effective way to help manage these symptoms is by medication, which can be prescribed by a psychiatrist or primary doctor. ADHD medication stimulates certain parts of the brain, improving concentration and reducing impulsive behavior. When it comes to non-medication interventions to manage ADHD, however, the options, unfortunately, are rather limited. But one method that can be helpful is cognitive behavior therapy, or CBT. To learn more about it in depth, feel free to click the link in the description below. CBT can be especially useful in teaching adults with ADHD organizational skills, such as creating structure, establishing routines, and determining places for essential items. Further, it can also aid with planning, coping with distractibility, and restructuring their thoughts. While medication can help them focus, CBT can then teach them what to focus on. If you're currently paying attention to this video, then please press the like button. Thanks for watching, and see you next time.